Hi, everyone. It's Anne, and I'm the host of Taking Questions. And today I am thrilled to be sitting down with Dr. Sapna Westley, who is a board-certified dermatologist. And boy, do we have a lot of questions for you. Thank you for joining me.
Thank you, Anne. Thank you for having me.
So the first question I have is, why does skin age faster in menopause?
So, skin ages faster because of the loss of estrogen. Now, estrogen is one of the most important hormones in our body. It's responsible for hydration of the skin, it's responsible for collagen stimulation of the skin. So what we find is that when estrogen starts to diminish in perimenopause and then in menopause, skin elasticity decreases, hydration of the skin decreases. So that all contributes to skin feeling and looking more aged.
When a patient comes in to see you when she's in menopause or perimenopause, what are the most common questions that you hear?
So a lot along those lines. I kind of think that a lot of it is they present with dry skin that they may have never had. They're itchy because they're so dry. They just feel like their skin is aging. They complain that they're starting to see more wrinkling of the skin, more sagging of the skin. Sometimes it's pigmentations of the skin that they never had, more sun damage of the skin. But generally, it's more to do with the loss of collagen, the aging process that they feel is being accelerated, and then just the loss of the hydration that they are used to having and more dry and then sometimes even itchy skin that's very symptomatic for them.
So when she's out in the marketplace and looking for products for her skin, what kind of ingredients are the best for taking care of menopausal skin?
So I think along the level of dry skin, I usually recommend hydrating ingredients in general. So, it's a conversation that patients have to have with their doctors regarding hormone replacement because that can help these symptoms. But if that's not an option, then I usually recommend more hydrating products for the skin rather than more, harsher, like more abrasive products. So I like cleansers that say hydrating that are very gentle on the skin. Usually we'll kind of go through bathing instructions as far as like keeping showers a little bit quicker, not too hot water, more warm water. The most critical time to moisturize is right when you step out of the shower after you towel dry. And I always say, try to look for something, especially everyone's degree of dryness is different. And then it can also be seasonal. So, right now in the winter, people who are in menopause are having extremely dry skin. And I usually recommend finding something that's in a jar rather than a pump. So something that's a little bit more occlusive, moisturizing right away when you step out of the shower. And then some people need to moisturize again before bedtime. So I think it's really important to use more products that are labeled hydrating, moisturize really well, keep, showers quick. And then we can talk specifically about specific, ingredients as well that you can look for in, facial moisturizers, for instance.
Like, what is the biggest ingredient that you should be looking for in a facial moisturizer?
So I think for dry skin, hyaluronic acid is one of my favorites. I think hyaluronic acid really traps all that natural water back into the skin. So especially when skin feels more dehydrated, more dry, again, with the lack of estrogen, you really do lose that hydration, natural hydration to the skin. So I love hyaluronic acid. And now you can find it in all kinds of ingredients. Moisturizers, serums, even a lot of cleansers have it added in too. So I think, and the nice thing with it is it hydrates, but without feeling, I think, too heavy or occlusive and causing clot pores on the skin. So that's one of my favorite ingredients. I also like ceramides, which are basically a building block for the skin barrier. So there are some products out there that have ceramides built into them. And ceramides are really nice because they help to enrich the skin barrier. And I think it can help, especially with people with really dry skin too.
You talked about moisturizing when you get out of the shower. Are there certain routines that we should be sticking to? Morning routine, night routine? Do you remove the makeup first, then moisturize, then SPF? Do you exfoliate regularly? Let's talk a little bit about routines. First, start with the morning.
Sure. So in the morning, and this is for the face, what I like to do is use a very gentle cleanser. Something that's just a very gentle, hydrating cleanser. We haven't yet talked about anti-aging ingredients, but sometimes if people are using like an anti-aging ingredient, like a vitamin serum, I usually recommend that goes on clean skin just to get the maximum absorption. Then I do like to moisturize on top of that with just a facial moisturizer, like I said, sometimes containing hyaluronic acid, sometimes containing ceramides, and then the most critical ingredient is your sun protection every day, 365 days a year. On top of that,
on top of it. So if you don't have the SPF in your moisturizer, you put it on top of
yes.
everything.
Yeah, and you can also find a lot of moisturizers that have SPF built into them, which are fine. But depending on people's level of exposure, the time of the year, it's important to sometimes have an additional SPF on top of a moisturizer, and then from there, makeup can be applied.
And how often should a woman exfoliate her skin?
It's sort of a personal preference. Everybody's degree of, I guess, irritation tolerance is so different. I usually will recommend maybe 1 to 2 times a week. There's different forms of exfoliation. There's chemical exfoliation and then there's mechanical exfoliation. So I usually recommend, depending again, some people have more oily skin, they can handle it 3 or 4 times a week, especially in the summer when it's more humid. This time of the year in the winter when it's really dry, I usually recommend 1 to 2 times a week. And I tend to recommend more chemical exfoliants rather than mechanical, like scrub type exfoliants, just because those can be more abrasive and cause more dryness on the skin.
Mm-hmm. And what about a serum? How often do you use a serum?
I mean, serums, I think it's, again, depending on what the active ingredient is in them, the tolerability of a serum, daily is fine. If somebody is using a serum, say that has like retinol at nighttime, which is another great ingredient for menopausal skin, for stimulating some of that collagen and helping with the appearance of the wrinkles, sometimes that can be a little bit drying for people. So I'll tell people to start with a retinol-based serum maybe every third night and increase it as tolerated. So it just depends on what the active ingredient is and everybody's sort of tolerability to the different active ingredient and the different serums.
Mm-hmm. Let's talk about collagen, because you just mentioned collagen. Can you replace the collagen that we lose in menopause? And then I'm going to follow it up with, how do you feel about collagens in powder?
So you can do things to stimulate the collagen, I think, with menopause and just aging in general. And also remember, menopause comes at a time when accumulation of sun damage over the years, sometimes the sun damage shows up decades later, people who smoked, so there are other factors that cause loss of collagen. And I think it all sort of culminates in people in their women, especially in their 40s and 50s. So we're sort of seeing not only hormonal changes, but also the sun damage. So you will never have the collagen you had when you were 20 years old. But there are things I think that you can do to help preserve and to stimulate your body's collagen. So I am a huge proponent of retinol. I think sort of the younger people start, the better, but it's never too late. I have a lot of patients that start even in their 50s and do well with it because it does help to stimulate the collagen. It helps with the appearance of fine lines and wrinkles. It also helps with sun damage, sort of skin cell turnover. The skin feels smoother. The texture feels better as well. The jury is still out as far as collagen supplements and powders go. I think that there's still a lot of data that needs to be collected. I know it's a very, big industry out there. As far as peer-reviewed studies go, we don't have a lot to say collagen benefits for the skin and the absorption into the level of the skin that we need. I think that there's some good data for hair, for nails. And I think they're getting better in terms of the formulations.
So if you have brittle nails, you mentioned nails, what can we do about brittle nails?
So brittle nails, a supplement called biotin, I think, which is a vitamin B based supplement, is really nice for brittle nails. So I recommend patients use biotin. There are even just nail conditioners, over the counter things, even just like Aquaphor Vaseline at nighttime to keep this, to sort of add that hydration back to the nails. There are specific, cuticle oils that you can also apply to the nails. And then we do have some prescriptions, strength, sort of nail strengtheners too, that I'll sometimes recommend patients too.
And if we're going to talk about nails, we got to talk about hair.
Mm-hmm.
One of the bigger complaints about our hair as we are in menopause is the thinning hair. Yeah. What do you recommend for somebody who is experiencing thinning hair?
Yeah, that's a tough one because again, there's a lot of causes of hair loss, and a lot of times it does sort of present itself in menopause. Some of it is genetic, and everyone has sort of a different rate of hair thinning that they'll experience. Also, I usually recommend people have their iron levels checked. Some of their vitamin levels, check their vitamin D, because some of if that's sort of deficient, thyroid levels. So I think it needs to be worked up pretty thoroughly just to see if there's any other culprits out there. I recommend trying to increase protein in the diet. I think protein is really important for hair growth. So I usually recommend patients try to, increase the protein intake in their diet. Biotin does have some studies, like I said, helping with hair. There's other supplements out there too, that can help with hair. And then minoxidil or Rogaine, no matter what the culprit of the hair loss is, that can be found over the counter topically, and that can help sort of get the hair back into a sort of growing state, stabilize the hair growth. And then now we're even using minoxidil by mouth as well, which I found to be pretty helpful for some women too.
One of the questions I got was, can you tell me about AHAs, lactic acid, BHAs, and PHAs? And can we use them on menopausal skin?
You can.
Let us know what those are, and then can we use them?
Yeah, so AHA is alpha hydroxy acid, also known as glycolic acid. And actually, that is one of my more favored ingredients in menopausal skin. I feel like, especially again, if you slowly and as tolerated, glycolic acid is another ingredient that does help with texture and tone, and also stimulating collagen. So some of the loss of laxity, elasticity, I think it can help with that. So that's a nice ingredient to add in, and it does come in moisturizers, it comes in cleansers as well. But again, it can sting, it can irritate a little bit, so it has to be used slowly. BHA is more of a beta hydroxy acid, it stands for, which is also known as salicylic acid. And I don't usually recommend unless somebody is having acne or very congested on the skin. So some of the patients with oilier skin, or if they're still having acne, which I actually do see quite a lot of in perimenopause and in early menopause too, that is a nice ingredient that can be added in slowly too. And then PHA is another form of a fruit acid as well that can help with texture tone. So I am a big proponent of the sort of alpha hydroxy, or the, just hydroxy acids in conjunction with, say, a retinol. But again, it has to be added in slowly.
Okay. Can you tell me what kind of treatment is available for rosacea? Someone has it really bad with the bumps and the redness on her face. What kind of treatments can she use?
So rosacea tends to be genetic. It does sort of happen again, 40s, 50s is when it starts to really present in patients. We do know the sun is the number one trigger. So another reason why we tell patients with everybody, but especially in rosacea, sun protection is really critical. Trigger factors for rosacea, everybody, it's so different. So I think a lot of times I'll talk to patients about what the most common triggers are. Dietary, spicy foods, alcohol is another big one, hot liquids, stress, the hormonal changes. So there's so many different triggers that people have to be aware of. So trying to limit those if there is one specific trigger. Trying to keep things gentle. I find my patients with rosacea tend to have more exquisitely sensitive skin. So I usually will recommend patients use more gentle hydrating products, the hyaluronic acids we talked about, the ceramides we talked about before, sun protection, limiting the more exfoliating products on the skin, because that can trigger rosacea. And then a lot of times patients with rosacea, especially if they're having a lot of sort of acne associated with it, pus bumps, red bumps, a lot of times they should see a dermatologist because we have all kinds of prescription creams available. There's even an oral medication available that's really nice for reducing the inflammation of rosacea. And then we do all kinds of laser treatments because one of the most common things in rosacea is the broken capillaries and the flushing and the redness. So we have laser treatments now that can address that too.
We get a lot of questions about itchy skin and menopause. What causes the itchy skin?
Usually the dryness. So it's usually just that lack of hydration in the skin. I think when your skin doesn't have that hydration or the level of the moisture in the skin that it had before, the barrier becomes a little bit more diminished. So you are becoming much more sensitive now to things in the environment, the cold, the wind, fabrics, detergents. So a lot of times it's just really boils down to the lack of hydration in the skin. So I usually again talk about the importance of moisturization, hydrating products, drinking a lot of water, humidifier in the bedroom, especially in the wintertime, can help significantly too.
It seems like we get itchy skin everywhere. Someone was even telling me they had itchy eyelids.
Yeah.
And she felt like she was getting scales on her eyelids.
Yeah, I see it a lot. And then a lot of times if it gets to the point where the skin starts to get sort of chapped, break down, almost look like eczema, then a lot of times we actually have to add in even a prescription for short spurts too, to like really calm it down as well.
So someone asks, what can I do to maintain my skin's youthful glow?
So I think it's a combination of internal and external things with, I sort of, again, talk about the importance of sun protection, a good healthy diet, just fruits, vegetables, the high antioxidant diet, I think is really important with aging. I think fish oil, omega-3 rich diet is also good for kind of just helping with that kind of like natural kind of glow and moisture to the skin as well. Don't smoke. That's a big no-no for the skin, especially with aging too. And then as we talked about before, I think it's adding in appropriate ingredients. I think the glycolic acid's a nice ingredient. Ceramides are a nice ingredient. Hyaluronic acid, because of that sort of hydration to the skin that it's adding, really helps people feel like they're getting a nice glow to their skin as well. And then, like we talked about before, retinol is such a big ingredient too, because it really does have the most data for waking up collagen, texture, tone, sort of helping with the, fine lines and wrinkles too.
Is there a good time to be using retinol? Is retinol better used in the morning or is it better used at night?
I usually recommend at night only because I think the sun can deactivate it to a degree. And then retinol, because it's sort of promoting skin cell turnover, you're getting more sort of healthy skin. It causes a little bit of exfoliation. I do feel like it can make people a bit more sun sensitive during the day. So I usually recommend a retinol at night and a vitamin C serum or vitamin serum in the morning, which is more of an antioxidant serum.
And not at the same time, right?
I usually don't. I usually try to keep it simple. I usually recommend this antioxidant because the antioxidant, what it'll do is it sort of prevents sort of damage to the skin from the things we're exposed to during the day, the sun, pollution, smoke. So I think using an antioxidant serum in the day, you get the most benefit. And then I always think of retinol as kind of a repair, which I think you get, the best benefit overnight.
And how many times a week would you use retinol?
I sort of say as much as tolerated. Everybody's skin is so different with retinol. Some people, even after years of using it, can only use it once or twice a week, and that's fine. It's better than not using it. And there's other people who have just more sort of thicker, more, oilier skin that can use it every night. A lot of times people have to back off in the winter because it's more drying. And in the summer, when it's more humid, you can usually tolerate it a little bit better. So I generally tell people start every 3 nights and then increase it as tolerated, and everybody is different. And then eventually, I usually do recommend that patients, once they are used to using an over-the-counter retinol, see a dermatologist and get on a prescription one because the prescription versions are stronger, more effective. and I think really help with that collagen stimulation that we need.
Can you let us know what melasma is and what are the best treatments for melasma?
Melasma is difficult. Melasma is hyperpigmentation to the skin. So it's usually kind of a patchy brown pigmentation that occurs on the forehead, the cheeks, the nose, the upper lip. It's usually triggered by sun, number one. Genetics play a role with melasma as well. And then hormonal shifts play a big trigger. So this is a condition I'll see a lot of times when women are pregnant or post-pregnancy, just with the hormonal shifts. And then I'll see it again around perimenopause and menopause. And once the pigmentation is there, it's really stubborn. It's difficult to clear. You'll probably never clear it completely. Sun protection, again, is really vital because you can do all these things to fade it, but if you're not careful with the sun, the pigment will come right back. So I always emphasize that to patients. The sun protection in melasma is really vital. And then I like ingredients for melasma that help promote sort of skin cell turnover. So things like we talked about before with glycolic acid, retinol, hydroquinone, vitamin C, kojic acid. So there's all kinds of, and then we obviously have prescription products too that are even more effective for patients with more stubborn melasma.
Dr. Westley, I want to thank you so much for joining us today. We've had so many great questions from our community, and I know we're going to have a lot more, so I appreciate being able to reach out to you and get these questions answered.
Thank you so much. I'm happy to help. Thank you for having me.
Of course.